One of the most important parts of the physical examination is the ophthalmoscopic examination, providing us with a wealth of information about the patient's health. This is the only non-invasive means of directly viewing vasculature in its native state. I'm going to demonstrate the use of the ophthalmoscope by using three different types of equipment. The first is the standard direct ophthalmoscope. A direct ophthalmoscope is an instrument which has a series of lenses which takes into account your refractive error as well as the refractive error of the patient. It's a light source which allows visualization of the cornea, the lens, the vitreous, and the retina. In order to use this instrument, you want to use the instrument held in your right hand using your right eye to examine the patient's right eye. In order to do this, you should remove your glasses and have the patient remove his or her glasses as well. If the person is wearing contact lenses, or if you're wearing contact lenses, they may certainly be left on. The light should be placed on, as I'm demonstrating here, and the patient is asked to look in the distance. You should stand approximately 15 to 20 degrees off midline and elevate the patient's upper lid as the ophthalmoscope is placed against your right eye to examine the patient's right eye. The first thing that you'll notice is the red reflex. If a red reflex is not seen, one has to be concerned that there may be some opacity, such as a cataract, in the lens. As you move closer to the patient, you will turn the lenses to focus deeper as one gets into the eye, past the lens, through the vitreous, and then into the retina. You must always be at eye level with the patient. First visualize superior nasal, inferior temporal, and superior temporal. And Mr. Johnson, please look at the light. And at that last second, the patient's macula has looked directly at the light, and one is looking then at the fovea of the macula. We repeat the same procedure on the left eye using your left eye and holding the equipment in your left hand. And again, I'm about 15 to 20 degrees off of midline, and keep looking in the distance. And as one gets closer to the patient, the diopter wheel focuses first as we go through the cornea, the lens, the vitreous, and now the retina. The optic disc is well visualized, as is the vasculature. Looking superior nasal, inferior temporal, superior temporal. And Mr. Johnson, look at the light, please. Thank you. This is the wall-mounted ophthalmoscope, and its operation is quite identical to the handheld unit. The only difference is that instead of the control on the handheld unit here, one has the on switch here. And the control of the intensity of the light is by this knob right here. In the newer wall-mounted unit, the brightness control is in fact in the handle. When one places it back into the holder, the instrument is turned off. The third instrument for direct ophthalmoscopy is the panoptic ophthalmoscope by Welsh Allyn. This provides a panoramic view of the fundus and provides a 5 times larger in diameter view than the standard direct ophthalmoscope. You can easily find the optic disc and the surrounding vessels, and it's easy to enter small non-dilated pupils. Whereas the standard direct ophthalmoscope provides only a 5-degree field of view, the panoptic provides a 25-degree field of view. This is actually 26% more magnification than the standard direct ophthalmoscope. The other advantage to the panoptic is that there is a greater working distance between the patient and the examiner, and I'd like to demonstrate it right now. The panoptic ophthalmoscope works with any of the standard 3.5 volt handles. This is the head, and this is the eye cup, and I will demonstrate its use in just a moment. First, one wants to use the continuous focusing wheel to focus on a distant subject, to get that subject in sharp focus. And then the equipment is used basically the same as your standard direct ophthalmoscope. A major difference is the eye cup. The eye cup, which aids in the stability of the unit, is applied directly to the patient's brow and is depressed about half of the length of the eye cup to visualize the red reflex. You should be able to see the optic disc, the physiologic cup in the disc, the arteries, and the veins. The cup is the portion of the disc that is central, lighter in color, and penetrated by the retinal vessels. The normal ratio of the cup to disc diameter varies from 0.1 to 0.5. The examiner should check the cup to disc ratio in both eyes for symmetry. The retinal vessels are evaluated as they arborize over the retina. The central retinal artery gives rise to four main branches that supply the superior and inferior aspects of the temporal and nasal quadrants of the optic fundus. And again, one will examine all of the quadrants as well as the macula in the standard fashion. A major advantage of this is that many individuals are one-eye dominant, and therefore may have trouble using their left eye to examine the left eye of the patient. With the panoptic, if you just turn this way, Mr. Johnson, and look straight in the distance, I can actually visualize Mr. Johnson's left retina by using my right eye, as I'm demonstrating now. In addition, of course, I could use the instrument in my left hand and examine the left retina as well. How are you feeling? Okay, we're now going to proceed to the examination of the ear.